So despite millions of South Africans rushing to vaccine sites when the program opened for those in the ages 35 to 49, the excitement appears to have fizzled out. The health department says fewer people are turning up to receive COVID-19 shots and is now urging men in particular to get vaccinated against the virus. South Africa so far administered more than 9 million vaccine doses and around 4 million people are fully vaccinated. Let's discuss the waning number of people turning up to take the vaccine with Professor Mosa Moshabela. He's the Acting Vice Chancellor for Research and Innovation at the University of KwaZulu-Natal. Prof, always great to have you on Newsfeed PM afternoon. So how are you making sense of the fact that after all of that excitement initially, we're now seeing the numbers of people who want to get vaccinated, or at least those who turn up, drop?
Greetings, Thembekile, and to the viewers of Newsfeed. You know, on the one side, on the one hand, Thembekile, I think that we have seen a lot of progress in the vaccination rollout in South Africa. We are finally at a point where we've got over 4 million people who are vaccinated amongst the adult population. And, you know, we often use this denominator of 40 million, which is people above of 18 years and above. But actually, at the moment, we haven't yet opened to the 18 million people between the ages of 18 and 34. So in itself, I think it's a huge progress to be at 10% of coverage. And if you now take into account the fact that there is people who are partially vaccinated, and when we include those, we are at about 18%. It means that very soon, when those people get their second doses, we will be at about 20% of coverage. I think that that's good progress for South Africa, even though it's taken a long time. And given the fact that we've got huge numbers of vaccine deliveries now, we no longer have vaccine supply. We have to then think about the demand side of vaccination and not just focus on the supply side. We have focused a lot on the limitations of vaccine supply, vaccine delivery in terms of sites, but we've been reassured that the capacity we have in South Africa currently is for more than 300,000 vaccine doses on daily basis. And if we expand it in the private sector, as was discussed, that we can go about 400,000 a day in terms of capacity. So to be at around 150, 160, 70 on daily basis, it's actually not ideal. We really need to activate the demand side of vaccination.
So, Prof, interesting then that government does acknowledge that we're seeing a waning turnout among the older groups for COVID-19 vaccinations, yet it was very clear yesterday that government appears still quite determined to wait until the 1st of September to begin vaccinating people in the 18 to 34 age bracket. Does that make the best scientific sense?
Yeah, it's a very important question, and I think that we need to talk about it. I think if you stratify the numbers, Thembekile, you will find that amongst the people who are 60 and above, we have by now covered over 60% of that population. And of course, that is the population that is most at risk, and we want to cover more than 60%. If we hit 70%, it will be something. But as much as possible, most of those adults need to be vaccinated to prevent them, protect them from severe disease. But we've made progress. If you look at the 50 to 59, we are now at 40%. And if you look at the 35 to 49, we are at about 25%. So it means that 1 in 4 of the 35 to 49 are vaccinated, and we need to increase that. So in general, you know, you will have the people that are enthusiastic about vaccination going in early to vaccinate. But when you start to push beyond 60% for this above 60, you need to really go out to find them. So it's a lot more work to find them. But my position is that because transmission of the virus really depends on susceptibility in the population, you need as many people in the population to be vaccinated. And right now, we have got the capacity to expand based on vaccine sites, but also based on vaccine doses. I think that it will help to get those younger people who are between ages 18 and 34, who are enthusiastic to come in and vaccinate and reduce the susceptibility in the population as soon as possible, because then that will buy us time for them to be fully vaccinated before we experience other threats in the future. And in the process, we can then work out mechanisms to really reach the hard-to-reach people, be it men, be it people who are older, be it people who are in remote places, be it people who are hesitant and so forth. We might then work out strategies to target those people. Provinces like Limpopo are already leaving the fixed sites of hospitals and clinics to actually go into outreach and strengthening the outreach strategies. And I think we're going to have to lean more on those strategies the higher we go in terms of percentages. But it will be good to start to focus on those strategies once we have our base covered in terms of vaccinating those who are willing to vaccinate.
And you raise
absolutely support it.
You raise an important an important point, I should say. It's one thing for us to assume that there's waning turnout because people don't want to be vaccinated, but some activists in the space say, just as you were saying, people are having difficulty accessing sites in certain communities because they need to travel quite a distance, for example, to get there. So I wonder if government is focusing enough on those sort of dynamics.
Yeah, no, naturally, government it's not equipped, it's not designed to focus on adaptive and agile strategies of delivering services, especially prevention services that require for service providers to go out to where people are. It's not the natural kind of delivery model of services, but it is necessary in this regard. And we have seen that when government partners with NGOs, partners with private sector partners, with different sectors of society, they are then able to provide those agile services that can be presented in the form of outreach. So, for example, men, we know it's a historical challenge that we've had of men coming to health services. It's always been a problem with HIV, with other health diseases. But then it's not that men are anti-services. When you go to them and you speak to them and you offer them services, they will take it. They're just not going to come to the clinic to come and get the service. So it is those kind of innovative strategies that we're going to need, but they will take a lot more effort. It's better to focus on that effort once you've had, the enthusiastic population covered already with vaccination. Mm-hmm. And then I think that, we can create room for that creative interventions and strategies.
And we often get caught up, as we well should, in our own dynamics, but it must be pointed out as well that the issue of having supply but not enough demand for vaccinations is not uniquely South African, because about 2 months ago in the United States, there was a push by the government now having to incentivize people to turn up for vaccination. So how much leeway does the South African government have to sort of incentivize people? Do you think we'll have to go in that direction?
Yeah, no, I've seen that. And I think that I've also seen in South Africa, GAME are also starting to offer incentives. But I'm sure that there will be other innovative strategies, especially when you start to involve multiple sectors in society, not just health. People are going to think of creative ways of incentivizing population. I don't think that it's the most immediate thing we need to do in South Africa. If it's there as part of the plan, that's okay. We can accept a complex package of offerings. But I don't necessarily think that it needs to be our key strategy. I think that our key strategy should really be to mop up all of those people who are ready and waiting to be vaccinated, and then begin to tailor our approaches to the specific populations that are facing whatever challenge, be it access challenge, be it hesitancy, be it whatever other challenge that we may identify. We can then find ways of accommodating them. Remember, we are dealing with prevention here. It's not like when someone is sick. When someone is sick, in a way, they don't even have a choice but to come to the health service. Here you're dealing with someone who's well. And so it requires a lot more effort for us to get to them and to be able to address their concerns and provide them with the vaccination. So I do think that we need to focus more on saying that what is it that those people who are not coming are struggling with, what is it that they need, what kind of strategies would work around them. And it is that agile kind of approach to health programs that I think that it's not a natural forte of how government provides services, but that's what we need in terms of this program.
Professor Mosa Moshabela, always great to have you on the program. So thank you. Enjoy the rest of your weekend.